So we'll start the presentation about the theory, the historical part of the electrical principles, the biological effect, the therapeutic effects, and the contraindications. Then we go to the practice part where we explain the electrodes, the set, the capacitive one, the resistive one, the return plate positions, and the different types of return plates that we have, the different types of electrodes, the optional electrodes, the useful functions of the equipment, the optional functions of the back three, the different modes of use, and we'll do like a little summary and the clinical reasoning. Then we'll take a look of some protocols that the Winback company, the Winback Academy has, so it can give you some guidelines in the beginning of your practical. So about the theory, the history of the Tecar therapy in 1819, the Jacques Arsenval, it's a famous French doctor that made some studies about the benefits of the current, electrical current on the plasma membrane permeability. And he found out that in frequencies over 100 kHz, they would have some influence on the permeability of the membrane. So in 39, Belmont, it's an English doctor, physicist, that explored the applications of the diathermia and the use of the high frequency electrical current to stimulate like a heat generation in body tissues. He done some work using capacitive and resistive methods, and he worked in frequencies around the 500 Hertz. So in 1985, the use of the high frequency current with multipolar electrodes was first used in aesthetic medicine. It was the principle of the electrical scalpel and started being used on medicine. So in 1995, it was only in 1995 that we then start the medical lecture studied on the use of the high frequency current and development of rehabilitation procedures using non-invasive mobile electrodes. Based on the Arsenval and Belmont studies, the term Tecar came up, and it's a capacitive and resistive electrical transfers. The new scientific studies were published in 1995, and the frequencies used was between 500 and 650 Hertz. And the studies were about the effects of the diathermia, were the main focus of these applications. In 2013, the Winback team developed the physical therapy protocols using a new generation of devices that were really more intuitive, more adaptable, and more effective in the use. So Winback was born in 2013. So the electrical principles are is the high frequency alternating current. We have a sinusoidal current that works and enables the current to adjust and to affect the different type of tissues. The frequency is about the number of round trips that it's made by the electrical current, sinusoidal shape, in 1 second. And the studies have been shown that frequencies between 0.3 and 1.2 megahertz induces an increase of the intra and extracellular exchanges. It increases the biological metabolism of the cellular, and it also has diathermic effect on the living tissue. It's really important to notice that the Winback only has effect on living tissue, okay? You need a cellular to increase its metabolism. So we have to know about the dielectric properties and the human tissue. How does the current affect the human tissue? We know that bone has a specific conductive, the muscle has a specific conductivity, and skin has a different conductivity. And we also know what is the conductivity. It's the capacity of conducting the electrical current. But another thing that it's really important is the permittivity. And it's what the permittivity, the available of the tissue to be able to permit the current to pass through it. So in this graphic, we can see that the permittivity is completely the opposite of the permittivity, the conductivity. So we found out that between 300 and 1 megahertz, it's the best performances between the permittivity and the conductivity. And it varies according to the tissue. So we really need to adjust the frequency that we work on according to the objective that we have, okay? So if we're working on skin, conductivity will work in frequencies higher than if you work on bone or muscle, okay? Any doubts?
No, no.
Okay. So about these principles, how will we work? We have different types of electrodes, and the different types of electrodes work in different frequencies. The only thing, like in the first one, 1000 kappa hertz, you have the multipolar electrode that works specifically superficial. It's so high that sinusoidal current stays only in the first centimeters of the skin. If we start working on the capacitive mode, we work in 500 kappa hertz. We work where? We work on the muscles. But if we want to go a little bit deeper, we can work on the resistive. We work in 300 kappa hertz. So the higher the frequency is, the more concentric and superficial it's the effect of the current. But if you lower the frequency, the more diffuse and deeper you go. Okay, the frequency and this difference of frequency allow us to achieve optimal balance between conductivity and permittivity in different kind of tissues. It allows also to optimally target the tissues at different depths. It allows us to tailor the machine to work on the tissues and depth required to optimize and to have a good result. So basically, what is the Tecar? Tecar is a transfer of energy, capacitive and resistive. Tecar is a high frequency current with inductive transfer of current, the capacitive one, directly applied to the body, and you have two different modes, the capacitive one and the resistive one. But before, we have to know that Winback works with Ohm's law. And what does it tell us? Well, when we increase the intensity and we have more resistance, then we have more heat released, okay? So we have two things that will have influence on the energy that we are applying. One is the intensity that we choose, and the other one is the resistance of the tissue that we are working on. Okay, so one big thing, if you work on a muscle that is contracted, will have more intensity, but because it will resist more to the passage of the current. This is important also in the pelvic floor, because we really need to know how the tissues are, how well nutrited is the area that we're treating. And it's really important to know if the tissue is scarred, if the tissue is damaged, if the conduction, the nervous conduction, the vascularization is not well, we can apply a little bit more resistance or induce a contraction to improve it, to enhance it, okay? Understand?
Nou, als je dus, if you have more damage,
it will call the energy to that part, specific part, okay?
Yeah.
That's why it doesn't hurt when you have a bracelet on, because your resistance in your hand from the therapist is less, but the resistance in the patient with the there's more resistance. So when there's more resistance, more energy will go into that part.
Okay, yes. Oh, I understand. Yeah.
When you have the trigger points, you have a point that it's unbalanced, right? It's charged and it's completely contracting, and it has not the correct way of working.
Yeah.
When you have that and you put a normal current of Tecar, it will concentrate the energy on the point that you're working on. The point unbalanced applies more resistance to the passage of the current. Okay?
Yeah.
The same thing works when we want to induce like a contraction of a pelvic floor. We can do a little bit of pressure or initial stretch, like that the energy gets concentrated on the spot that you're working on, the motor point, for example. Okay?
Yeah.
So what is the important thing to sustain? The higher the resistance, the greater the heat, okay? The higher the intensity, the greater the heat. And heat is a response that is coupled to the energy. So we have 6 principles of the Tecar current that are really important for us to know. The energy accumulates from the smallest electrode to the largest one. So the return plate has always to be bigger or the same size of the electrode that is active. Okay?
Yeah.
The current Tecar always has a biological effect on the tissue, regardless of its intensity. So you don't really have to have a thermical response, but we always have some biological effects. Okay? We can work without the thermical response, the hyperthermia, and still have a good answer for the metabolism, a good answer for the enhancing of the rehabilitation. Okay? Third rule, the current always needs a path to travel. So we really need to assure that we have a good connection to the body and a good conductivity cream, a cream that is adapt to working in high intensities. It has to be the good conductive cream, okay? Number 4, the current will take the shortest route between the 2 contact points. So you really need to consider a good area to place the electrode so you have a fully connection. So if you have a little area that has some, it's not, how do you say? When you have bone irregularities, you should try a small hair, a smaller hair. So like that, you can ensure that you get the fully contact between the electrode and the anatomical area.
Yeah.
Number 5 rule is that the current requires 2 connections. Or the machine will automatically stop when you lose the connection from one of the points. So you have to ensure that the return plate is always connected to the patient and you do a right connection with the active electrode, okay? Number 6 is that the current will remain the same despite of the contact area. So you really need to focus on the size of the electrode that you're applying on. The bigger the area, the current will spread around all the area that you're touching. But if you do a little area, you will concentrate the current in one spot. So the response will be higher, will be bigger, okay? This is really, really important when we are working with our hands-free mode. We put the bracelet on our hands and we make the current pass from our hand to the patient. But if we find one perfect spot that we want to work on, we can just touch the fingers with that spot and we'll make like an accumulation of energy in that spot, okay? But the heating response will be big one, okay? It's important when we are working with hands-free. So what about the biological effects of the Winback current? It works in the cellular metabolism. How? It increases the intra and the extracellular exchanges. It's just Arsenval principle was Winback Tecar Winback Tecar therapy causes a flow of ions with excessively fast electric oscillations within the cellular environment. These oscillations of the ions will cause a permeabilization of the plasma membrane. The scientific and physical term to describe this phenomenon is the permittivity of the cell membrane. What's important? The ions come so excited that they enhance the liberty of energy, and that liberation of energy comes in a thermal way. Okay, we are stimulating the ions, and they get extremely quick the exchanges, and it gives the liberation of energy, and it's a thermical liberation. So what's important to know? With the Tecar therapy, we'll get the benefits of the cellular metabolism, and will enhance all the physiological effects and the cellular metabolism. We'll wake up the cellular and tell her you have to start working. We'll enhance the bioavailability of oxygen and nutrients. We'll take off all the extraction products and give new products to the cellular to work on. The metabolism can be increased without the heat response, but still promoting the reconstruction of the tissues in a sustainable way. The slight rise in temperature increases the supply of nutrients and the removal of toxins. How? If you increase a little bit the temperature in the specific spot, our body will respond to that increase of temperature with the blood flow, right? It try to sustain the homeostasis, and it will try to lower a little bit the temperature. Like that, we have a new blood flow to that area. We have new oxygen, new nutrients, and will take off the extraction products more quicker. Another effect is the analgesia, and it's a combination of 3 effects: the current effect, the diathermic effect, and the metabolism stimulation and healing process. So the synaptic interference at the nociceptor level, the Tecar goes and it stops the message from the pain vehiculated to the brain. We'll work with the gate control system. We'll activate the thermal sensors and the tactile sensors, and we'll block the nociceptor informations. Okay, so with the current effect, we have an immediate effect by disturbance and saturation of the nociceptors due to a very high electrical frequency. We'll just saturate it, and it will stop giving the information of pain to the brain. At the same time, with the diathermy effect, we have a middle term effect. With the thermic effect, we'll reduce the pressure on the nociceptors, we'll reduce the pressure on soft tissues and on fascia, and like that, we'll just enhance the well-being of the tissue. And by the metabolism stimulation and healing process, with this well-being, the warm feeling and the touch feeling will enhance the production of endorphins. And like that, we will lower our pain linear, and we will lower our P substance on the blood. So like that, we'll slow down and lower the limit of pain, and will enhance the production of endorphin and good hormones for the patients. Like this, we'll have a long-lasting effect of analgesia, and will improve the metabolism, the blood flow, and will release the tensions, lead to a lasting pain reliever. So with Tecar therapy, we have 2 effects: immediate analgesia because of the saturation of the nociceptors. We have like a disturbance of the nerve nociceptor information conduction, and we have a long-lasting analgesia because of the reduction of the spasms, a reduction of the tension of the muscle, because of the removal of noxious stimuli, and will lower and take off the substance P from the area that we're working on, and because of the restoring of the range of motion. If we can normalize the tension of the tissue and give in more mobility, we can work and have a long-lasting analgesia. Another effect is the diathermic effect. The diathermic effect is immediate and it's controlled by the power. So we've seen it before, if you have more intensity, we have more diathermic effect. If you have lower intensity, we have less diathermic effect. The diathermic effects comes from the response of the ions, from the stimulation of the ions. So the flow of the ions in the ionic channel, extremely fast, linked to the frequency of the current, will create a friction between these ions and induce an endogenous heat. We have the liberation of energy. So more intensity, more ions that we are stimulating, more friction between them, and more endogenous heat that we are producing. So in biology, the tissue's reaction to the passage of the high frequency current is called diathermia. And on Tecar and Winback, we can work in 4 levels. The first one with no heat, other than the slight thermal activity caused by the biological effect, just in little increasing of the metabolism, opening the plasmatic membrane, will have a liberation of energy, okay? After, we can work with some microcirculation increase, and we'll have what? And best support of oxygen, more nutrients. Here, we just have a little thermic response. If you want to work on the orange, we have a vasodilatation of vascular trunks. Here we have just increased the arteriovenous and lymphatic circulation. Here we have a thermical response that you can clearly see. And if you work on red, you have a strong localized thermia. We really have a new blood flow. We induce neovascularization, neocollagenesis. We induce a creation of new capillaries, and we induce the synthesis of collagen. It's okay?
Yeah, it's a little bit complicated what you told. But
I can go back.
I have a question for you, because it is on cell. I asked Hans from, yeah, I don't know if you know the answer, but if there is a cancer cell, what is the problem with that?
So that's one question. We don't work in active cancer, okay?
No, never. Okay, but I don't know that there is. You don't know. This, if you don't know, there is a kind of cancer cell in the pelvic area, and you treat it with this.
It's a cell like no other. So we'll induce and increase his productivity and the metabolism, okay?
Yes.
Also for a cancer cell.
If you don't know,
you don't know.
Work like you just work with the, how can I say, it's biological effect of each body. You don't induce anything, but
No.
you really are increasing the metabolism of the area. If you don't know, if the patient don't know, it's something, it's like other procedures that we do.
Okay.
So I have one question.
Usually, I don't work in, if you have an active cancer, you don't do any agent, right?
This more the question if you don't know it.
Yes.
If you don't know that somebody is in the uterus or something like that, and you treat,
That's always the case with every treatment.
That's it. we don't do any physical agent if we know that we have a cancer. But like that, sometimes I get women with urinary incontinence, and we do pelvic floor stimulation. I do the massage. I do the hand stimulation of the contraction. I shouldn't do it also, not the electrical. But I didn't know that we have a cancer.
Yeah, precies. Exactly. Okay.
I shouldn't do the heat. You call heat also the treatment with the warm. I shouldn't do it if I have a cancer. But if I don't know, I'm not doing.
Yeah, you don't know.
The problem is the diagnosis.
Yeah.
You had a question, Sylvia?
Yeah, can you hear me quite good?
Yes.
I have a question because our competitors, I don't want to give the names of the companies, but they are recommended to use Tecar therapy for a patient with active cancer. And I was also surprised because they have just 2 small studies and they are not the big and good studies. But our clients and my people in Poland are asking about it. Do you have any knowledge about it?
Hello? Okay.
Maybe Hans, you know something about it because you know a company and I have in my mind, but I don't want to call it the name. But
you can call it this.
Because it's big case, because we are talking with them about it and they are not able to explain that, but our clients are surprised. And you see, my opinion is the same, that we shouldn't work with big temperature with cancer, active cancer patients, but
if they say they can do, then it's only positive for us because it's not, you know, so they're not very very well known. If they
I'm sorry, can you hear me?
yes,
Hello?
you again, yes.
I lost you.
Yep.
Yeah.
You were asking about.
I was asking about different companies who they have studies, not very good, but they have studies that the Tecar therapy is recommended for cancer patients. And what is your opinion? Do you have the same cases in your country?
Cancer is a specific area. Like, I work with post mastectomy.
Yeah.
With the Winback on post mastectomy women. Okay. I work with the radiotherapy scars, and we have really, really good results. The important thing is that we don't work on cancer. Okay. The cancer goes to oncology, and they take it out. When we have the okay that we have no
cancer tissue in the patient.
When you the nodules that they are tested that are okay, we can do the treatment. Okay.
And how long after operation? Because in Poland it's 5 years. So if you had a cancer, the regulations say that you need 5 years and clear tests that patient don't have cancer and we can work. So what is in your country and what is your experience?
In my country, we have the oncology give you the patient. When the oncology says it's okay, I open it, it's clear, the ganglia are no positive cells. They give us the patient to treat on. Okay.
Okay. And
you don't have to wait 5 years.
Okay, stop about this because the Winback, there is a lot of to tell. So please continue.
So Sylvia, Winback never uses the unit on cancer. What the others are saying, we don't care. You know, we will not do that. Okay.
Okay.
You work on the good tissue.
Yeah.
Okay. After surgeries, when the doctor says it's okay, you work on. Okay.
Okay, thanks.
Somebody had a question also? No?
No.
No. So the thermal effect, therapeutical effects, the tissue healing. So how we will work on and how will we get results? We have activation of fibroblast activity. It increases and improves the neocollagenesis and the neovascularizations. And it gives the building of blocks of all tissue in the body. How? Increasing the bioavailability. So you go and you take the mechanism of H cell to I'm sorry, the word is, how do you say? Your own healing process, and you just take it quicker. You get the, you take the cell and you put the enzymes working for you, the elastin fibers, the collagen fibers, all the components of the extracellular matrix. You go and you stimulate the growth factors and you work with the hyaluronic acid. Like that, you can get new tissue, new cells, and the healing. The effects of the Tecar therapy on collagen. It basically increases the collagen synthesis and the oxygenation, but it also gets a better quality of the collagen that you already have in your cells. So, monopolar radiofrequency is valuable procedure that can be used to effectively tighten and rejuvenate the photoaged skin with little downtime. The tightening appears to continue for 3 months after the end of the radiofrequency treatment, and radiofrequency shown long-term effects of enhancing collagen synthesis and content, okay? It's important, like in the postmenopausal syndrome, you have some women with that we have all the vulvar tissue and the perineal area is completely atrophied, you say? You can enhance and to have like a new synthesis of collagen and elastin to give the power of new tissue and to just stimulate the tissue to regenerate itself, okay? If we have really, really good results in postmenopausal syndrome and with reducing the urinary infections associated to the atrophy of the pelvic floor, okay? So the effects of the Tecar therapy on fascia. So fascia is mainly the most important, one of the most important tissues in our body. And in the pelvic floor, I think it's one thing that we really, really, really need to value. So the diathermy and the fascia have a really good connection. The hyaluronic acid is an anionic non-sulfated glucosamine glycan distributed widely through the connective, the epithelial, and the neural tissues. The breakdown of these glucosamine bonds leading to a lower molecular weight of the hyaluronic acid with a lower viscosity can be accomplished with the heat at different temperatures from 37.5 degrees. The heat has a direct effect on viscoelasticity of the fascia up to 40 degrees on the regulation of the fascial stiffness. And heat effects of the peripheral nociceptors and nervous systems induces a direct fascial relaxation and resting muscle tone. So it's really good that you can work on the fascia because you can heat it and mold it as you want and reposition. And it's really important in the pelvic floor because we have a lot of structures, soft structures that really, really need to reposition and then to give it function back. The effects of the Tecar therapy on blood and lymphatic circulation. So we have two ways of thinking, the vascular, and the vascular functions are called on to self-regulate this localized heat. So with the Winback, we can increase the temperature of a small spot and we have like a response with vasodilatation to normalize that increase of the heating. Like that, we can profit of this function and to enhance the apport of oxygen, of new nutrients, and to get rid of the excretion products quicker, and to enhance the metabolism and the biostimulate the area. Like that, you will also provide new nutrients, new oxygen, so the fast working of the cellula does never stop because of not having the materials that we need. On the lymphatic way, when we work on lymphatic network, the current can trigger a rapid oscillation effect that will accelerate the drainage. So with the heating process, we'll work on the viscosity of the lympha, and when the viscosity goes down, we just lightly pump it and it goes quicker. We quicker the normal flow of the lympha on the lymphatic system, and in the same way as we lower the viscosity, we are working on the liquid that is in our cells, intra and extracellular tissue, and we will enhance it to drain it. So on muscular tissue, how does the Winback give us a response? Increasing the circulation and the oxygenation gives us a quick reduction in muscle spasm and improve the muscle recovery time. Tecar therapy was shown to be effective in the relief of the muscle soreness 24 hours after the application. Likewise, individuals treated with Tecar therapy had better recovery of muscle strength and function in the end of 72 hours of protocol. We've done a study here about the soreness with eccentric treatment in the isokinetic chain, and we have the sensation of muscular soreness was lowered in 80% of the cases, and we have a better result and better performance of the athlete in the day after. So Winback is indicated for all the stages of healing. You just have to adjust where you're working on. If you were working on blue, on a thermia, you can work in acute stages. You can work on pain management. You just work in the little biological effect. You just increase it a little bit, and you work on a thermia. You're not increasing the inflammatory response. If you work on gray, you work on pain management. You work on a good, just like super good conditions. You have a soft heat. You just increase the micro circulation of the area and the oxygenation of the area. When you are in subacute conditions, just to chronic, you can work on orange. And on orange, we have pain management, but we have already the strong heat response. We have arterial and venous system vascularization response, and you get the thermical effect with a good noticing the hyperemia, superficial hyperemia you're working on. When you're working on really chronic stages that you really need to enhance the new vascularization, synthesization of new collagens, new vascular neocollagen, vascularization, new capillaries forming, you work on red. And you have a defibrotic action, and you really have an answer of a diathermical answer, really visual. The contraindications of the Winback is the pacemaker or insulin bomb, the thrombophlebitis, the pregnancy. In minor patients, when you have the growth cartilage, you don't work on. Where you have numbness or warm insensibility, of all cases that you have trouble with sensibility, you don't work on.
I have a question about children. Do you work with children with Winback, or you have any recommendation?
We don't have indications to work with Winback in the minor patients because the ethical protocols are not allowed to do studies. So we just don't work on.
Okay.
Okay. In active cancer, we don't work on. In infection, or in some areas that we don't have continuous of the skin. If it's an open wound, we don't work on top of that. But if you have a post surgery, you work around it, not on it. Okay. The Winback only has effects on biological tissue. So we can work on orthopedical material. We don't have any problem with prosthesis. Okay.
And one more question about hormonal IUD. I mean, it's hormonal something put into the...
We don't have any contraindications to work with it. We can work. Okay, no problem. Any question?
No.
So about the precautions, what we really need to know, we have to explain the patients the objectives of each new treatment, the purpose of the technique that we are applying, and the gesture and the sensation that she can feel, she or he. So the thermical effect, the sensation of the little contraction, you have to tell her. You have to follow the patient's attitude and reassure her and to be attentive to the warm feeling. So in the beginning, we use lower intensities to know, because each body has a different resistance. If a body is well hydrated, it is available to have a stimulation. If the body is not hydrated, it will apply a little more resistance. And the resistance, it comes in the answer, in a thermical answer, okay? Not a good permittivity of conduction. We have to warn the patient of the possible post-session reactions, like a little contraction, some pain, a little inflammatory rebound in some cases. We have to make sure that the piercing around the treatment area have been removed to avoid the heat accumulation on the contact area of the jewel. And you have to ensure to ensure that the informed consent is signed from the patient, so you can do the techniques. Okay. Any doubts about theory?
No.
No? Can go to the practical. So the practical, now it's easier because the theory is a little bit complicated. We cannot do all the things that we've done along our way in a small time, in 1 hour, okay? Because we have the anatomy, the physiology, the principles of the physics. So if you have some doubt, you tell me, okay? We are trying to give you all the big lights. We have the set and ret explications, the return plate, the electrodes, the optional electrodes, the useful functions, the optional functions, and we'll do a little summary on the end. So we have always a mobile electrode, and we have always a fixed electrode. So the sets, the actions are produced under the electrode, and it stays focused under where the electrode stays. Okay. The set has a little recovered in a ceramic that ensures that you have a little field under the electrode. Okay. When you work on set, you have a ping pong ball of profoundness, okay, like 3 centimeters. When you work on deep set, that it's a deep, you work on a tennis ball, like 5 centimeters, and you have a little ball that is the area that you're stimulating. So it's important that you keep moving when you do a set stimulation, okay? The red, and this is the metal one that has no recover, the current passes through all the deep tissues until the return plate. So you have to notice where to put the return plate and where we will have the active electrode. The action with the red is polyarticular. The action on set is local. Okay? So, set is the soft tissue, is tissues that have a high water density. It's like muscle, is like fascia, is like lymphatic tissue, is like vascular tissue. We work on 500 kappa hertz. And when we are working on capacitive, we work on the 2 or 3 first centimeters under the electrode. If you work on deep sets a little bit more profound, we'll work on 4 to 5 centimeters. It's like the tennis ball I told you before. When we work on red, is this one without the recover of the ceramic recover, the metal one, we work on hard tissue. We work on the tissues that are really resistive to the passage of the current. Low water density tissue, ligaments, tendons, joints, bones. So we have to ensure that we put the return plate on the opposite side of the area that we are working on. Okay? It's important to notice that current will always take the shortest route, okay? We'll have a polyarticular effect. So if you want to work on the superior member or inferior member, we can do all the polyarticular work without being worried that we don't have the current. We get the best of the red stimulation with the movement or the mobilization or the pressure. It's really good to get aligned with our manual treatment or with our dynamics exercises, okay? In the depth, we can use the deep red or the red plus that we work in 300 kappa hertz and we have a deeper penetration. When we work with the bracelets, we work on the red plus, on the deep red. Like this, we have a bit more stimulation and our hand substitutes the electrode, okay? The current passes through our hand, the area that we touch, okay? So here we have an explanation of the red node. You can put the return plate on the sacrum and we can work on the pelvic floor directly, okay? If you want a small profundity, if you want to work on the clitoris, for example, that is more superficial, we just work with the set one, okay? And you work with 500 kappa hertz. The action is focused under the electrode in the area that you're touching on, okay? It's like 1 to 3 centimeters of the profoundness. Yeah. But if you want to work on the vaginal wall,
this one on that one.
Okay.
So
yeah.
And we have.
Sorry. Continue.
I'm having a little problems of hearing you.
Yes, I was just explaining that the red is not fitting on the set electrode because of the sizes of the electrodes on this. Hello.
Oké, dus even deze. Deze is voor de op.
Hello?
Hans, can you hear us? Because we can't hear you.
Hello? Hello?
Hello?
I lost you.
I can hear you,
Now
yes.
can you hear me? Okay.
Yes.
So, if you have a deep red, we can work on the
Do
vaginal.
you hear me? Yes.
Yeah.
Okay.
I got you.
Yes.
If you want to work a little bit more profound, we choose the deep set, okay? We are working on 300 kappa hertz and we can think like we have the dip of a tennis ball, the normal green ones, okay? If we want to work on the deep perineum, we work with deep sets, okay?
Yeah.
The return plate positions. It's important to keep the return plates near the area that we are treating on, but we don't have to ensure that it's on the opposite side, okay? Here we have two examples. We are working on the lower chain and we have the return plate on the abdominal parts, okay? You don't have to ensure that it's on the opposite. It's not transarticular. But you always have to think about the way that the current passes. In the red, it always takes the shortest way, okay? So here we have the example, how we place the electrode and how do we place the return plate about the area that we are treating on. If we were working on the abdominal part, we are not stimulating the pelvic floor, the superficial perineum. But if we work directly on the perineum, we have all the stimulation, okay, just to the return plate. The good one is that we can be always on movement with the electrode or even with the anatomical parts. We can induce the contraction or the mobilization on the patient. We can work with Winback when we are doing the contraction exercises at the same time to enhance the contraction, so the patient notice where to contract, okay? So the influence of the tissue resistance. All the living tissue has some degree of resistance to the passage of the current. An increase of the resistance results in a higher voltage, which is transformed to a bigger heat localized. So we have to always think about it. When you have something that resists, when you have a scar, it will apply more difficulty to the passage of the current and it will accumulate the stimulation on that area. Resistive factors, the anatomy of the area, the pathologies where you have contractures, fibrosis, trigger points, the active muscular work. When we are doing an active muscular work, it will enhance the influence of the current, or the manual techniques or tools that we use. If you use a hook, if we are doing mobilization, a massage, or even some pressure on a specific place. So inset is the yellow one. All the electrodes have different colors. So the set is the yellow one, the red is the blue one, the return plate is the gray one, okay? And the multipolar are green. So the set we work in 500 frequencies, kappa hertz, and the deep set 300 kappa hertz. We have 3 available diameters of the heads. I don't know if Hans has to show you.
Yes.
A small one, a medium, and a big one. And for the pelvic floor, we have an extender with a convex electrode that it's easier to work on soft tissue and to ensure always a good connection. Okay?
Now
The extender... I lost you.
Okay. Yeah. We found them.
So we have the extender to enhance, to assure the hygiene, to assure that we can see where are we working on and the answer of our stimulation, and also to put the condom on, okay? We have a special gel that assures the conductivity and we put a condom on to protect the sound, okay?
Yeah.
Yes, that's it. And the electrode is smaller and it's a little convex, because on the pelvic area we have all the irregularities of the anatomia, and like that we can ensure the touch, the full touch of the electrode, and that it's more comfortable for the lady, okay, to feel.
Yeah. And there over the condom wheel. Where do you put the condom?
On top, you
On
put
top.
a little bit of the gel, the conductive gel, just for pelvic floor, and then you put the condom on with the extender.
Okay, so you go
press it.
inside? You go inside with it?
You can work all your techniques all the way you work like before. The conductivity is assured like that, but you push it until back, okay?
Okay, yes.
Push it down, totally
You
down.
have the good hygiene. Like that, you can hold it like this, and you see the pelvic area that you're working on, okay?
Yeah.
Important with the capacity. Always move, always keep moving, because the thermical answer is localized under the electrode, okay? And in the skin, you see the hyperemia, the answer, the thermical answer. On pelvic floor, the mucosa, we don't have that redness, okay? So it's important to always be moving and increasing the intensities by the way when you ask the patient how she feels, and you also feel it with your other end, where you touch, okay?
Yeah.
Important, you always need a return plate to close the circuit. In the rat is the blue one, is the metal one that has no recover, and we work on hard tissues. And we also work in chain, and we also work on dynamic, and we also work when you want to have our hands free. So rat, you can work with mobile electrode, with the extender and the condom, with the fixed pad. And what is a fixed pad? The fixed pad is a fixed electrode that you place in the patients, and like that you ensure that the current passes all the way from the fixed pad to the return plate. One example, if you want to have your hands free on the pelvic floor treatment, you can put the return plate on back, okay? Let me just lower a little bit.
Yeah.
And you can put the active electrode, okay, suprapubic, and you can work with your hands in all the cavity. Or if you want to focus, you can put the active electrode on one thigh, the return plate on the other thigh, and you know that the current passes all the way through the perineum. If you have a vaginism case, let me just check. I was trying. Okay, like this, it's okay. Imagine like this, it doesn't, if you have a vaginism case, that the patient has a lot of pain, that cannot stand with your touch, you can always work with the biological effect and the analgesic effect. You place the active electrode in one side, in the internal part, and the return plate in the other one, okay? And like that, you ensure that current passes all the way through it, okay? And like this, you'll have the analgesia of the area. If you are working in one patient that has no conscience of the contraction of the pelvic floor, you can put the active electrode suprapubical, the return plate on back, on the coccyx, and you can work inside the cavity with the contraction, inducing the contraction, doing the initial stretch, okay?
Yeah.
Another thing, always need the return plate, and the resistive, you don't have to worry with the one always moving, okay? And you know it's a chain work. It's all along from the electrode to the return plate. So we have 4 options of return plate. We have the fixed plate, that it's a big metal plate. You can clean it from one patient to the other, and it's really easy to put in every position. But if you work on dynamic, like pelvic vascular, or you wanted to do some work with the patient, you choose one fixed pad that gives you more freedom, and you don't have to worry that it won't fall out, it won't stick out. You can use the fixed pad, the little one, or you can use the adhesive plates, okay? At the same time, you can also use that one, that it's a mobile electrode, okay? We combined the active and the passive electrode. And like that, you can be always changing the positions to have a perfect focused energy between your active electrodes, okay? Option, we have the convex electrode. It's used when using dynamic setting. The convex electrode is very useful for massage techniques when you want to take advantage of the mechanical action, like in adipose tissue massage. When using this electrode in deep set, you can it's easier to recruit the deep vein system or the lymphatic pumping, okay? For doing the call in drainage area or the pumping, you use it. It enhances the heating answer quicker. It's easy to use in visceral manipulation when you're stimulating the popliteal fossa, or when you're working on the foot arch because of the mechanical effects. It can be used in dynamic, in deep set. Also, we have the tie electrode. The tie electrode is one set electrode that has a little pump in the middle, and it was designed for massage work, for stimulating the trigger points, for doing strapping techniques, to align the tensor of the fascia lata, to work on the piriformis. This unique electrode will be used most of the time on set dynamic, so we can be working on set, deep set at the same time, so we don't have the heating answer, okay? So you don't have to worry about moving all the time the electrode, and like that we don't have the feeling of burn, okay? Okay, any doubt? No? So, useful functions. Dynamic. What is dynamic? Automatic scanning between superficial and deep soft layers. You choose between set and deep set, the machine chooses automatically, and like that you don't have to worry about the feeling, the temperature feeling from the patient, okay? When you work on set, you have all the thermical sensors, okay? When we work on the deep set, we have less thermical sensors. So like that, we don't have the acute response of the heating. In dynamic, we simultaneous multi-layer tensions releasing and vascular recruitment. We can also work on low pulse or mini, okay? It's a fine management on inflammatory areas. Or we can use it when we are trying to accelerate the drainage techniques with the pumping effect that I told you before. And we also will use low pulse when we are doing the optimization of the return to calm in the end of each session. The super pulse or the boost is what? It's like concentrating all the effects in one area. It's like a deep liberation of energy. Is when you are forcing areas that are not well vascularized, when you have a fibrosis, when you have a contracture, when you have a scar, and you want to induce the new neovascularization. You want to induce the creation of new capillaries. You want to induce the synthesis of new collagen. You want to have a great thermical response. It just boosts the drainage by limiting the patient's seat discomfort, but it gives you a real heat impulse, okay, with lower discomfort from the patient. And the tick option, it's present on the back color. That is the option that you can change the intensity without touching the screen. With 3 quick contacts, the electrode will increase 10%, and with 2 quick contacts, it will decrease 10%.
Oké, 10%. Zo kan je doorgaan. Ja.
Without touching the screen.
Without touching, it's easier when you're working on pelvic floor, so you don't conspirate the screen and the area, okay?
But it's on the back 3 SE, yeah?
Yes, back 3, SA or color.
Yeah, okay.
Okay.
It's niet on these.
Nee.
Another optional function is the multipolar function. And what is the multipolar? With the multipolar, we have a change between we have 3 little heads that changes the stimulation between them. 2 are emitter and 1 is receptor, and they are changing between them every 3 seconds. With these heads, we don't need the return plates because they do the emission and the reception closes the circuit. This mode offers a manual electrode with several dynamic poles that switch alternately between the emitting and receiving the current. The amount of energy with this multipolar function is optimal for cellular stimulation over a surface area or a few centimeters of tip, okay? We just go in skin or 1 centimeter under, okay? We can choose from the option soft, the mix just, or the mix plus the deep. The soft, we are working in 1000 kappa hertz frequencies, and we are stimulating skin. When we choose the mix plus, we are working deeper. We work in 500 kappa hertz stimulation, and we work 1 centimeter deep, okay? With this kind of stimulation, you have 2 to 3 times faster answer from the stimulus that you're giving. So you know that your work will be quicker and your effects will be quicker, okay? We also have the beat or the pulse function. The low beat, it's a 2 hertz signal coupled with the Tecar energy that activates a nervous fibers to generate elementary muscle twitches. You feel like little contractions. This dual effect accelerates the release of the tension. We can really work with in contractures and the fibrosis because we generate small twitches, and it stimulates the circularization, the vascularization and the drainage. Because of those switches, you stimulate a good drainage. And you can also have the super beat that are 4 hertzes stimulate a signal that is twice as fast as low beat for treatment in superficial areas. It's important that the beat only works in the resistive mode, okay, with red plus, and you can find it in the back 3 SA on in back 3 color. Which is the equipment hand, sorry?
It's the back 1S. The back 1S.
Okay. So, in the 2 hertz, it activates the nervous fibers to generate the elementary muscle twitches. This dual effect accelerates and releases the tension and stimulates the circulation. When you have the 4 Hz pulse, is twice as fast as low beat, and we will use B for treatments on superficial areas mostly. About the swap function, it combines alternately the emissions of the set stimuli and the red stimuli. Every 3 seconds, the machine will automatically change the capacitive stimulation and the resistive stimulation. And this is the only one that you don't have to worry about moving the set all the time, okay? We told you before that the capacitive mode, you have always to be moving the electrode. But when we are working on the swap function, we don't need, because we use the swap goes changing the stimulation between the capacitive and resistive. In that 3 seconds, we don't have the problem of burning, of the feeling of burn from the patient. The energy is therefore divided between the capacitive stimulation and the resistive stimulation, and you can perform a stimulation vascular on a resistive path to save time to release the contractors. Here we have an example. If you are working on the ischiotibial muscle, you can do the local stimulation with the capacitive electrode, and the resistive will work on the back chain. You always have to have a fixed return plate, and here we have the position on the abdominal part, okay? So this is the back 3 color programs. We have the 2 Hz that came to replace the low beats, the little twitches. We have the 4 Hz that replaces the super beat. This always on red, okay? You have the pulse mode. You have the super boost, the boost that replaces the super pulse on back 3 SK and back 1. You have the soft for a superficial action that was the set, or you have the deep for a deep action. And you have the frequency setting.
Okay, sorry. I was explaining something on the unit.
Okay, but if you want, Hans, if you want to explain on the machine.
No,
yes,
no.
Yeah, we did just. It's fine.
Okay.
I think this is important.
This is, yeah.
Now we're getting on the important stuff.
Now it's pelvic, okay?
Yeah. Yeah.
So in pelvic, we can work with mobile electrode, that we have the set one or the red, and we have always to focus in the return plates. We have to ensure that it really makes a good contact with the patient, and that it stays close to the area that you're treating, and that it closes the circuit. We have to ensure that we really screwed well the extender to the handle, the set or the right one, depending of the type of the handle. They are different, okay? You have to place the probe cover, the condom, thin and preferably in polyurethane, over the electrode and through the extender and the handle, okay? You have to put
over the handle.
It goes all the way back till the handle. You have to stretch it on.
Yeah, stretch it.
Yes.
Okay?
Yeah?
Like this.
You have to put a Winback conductive gel dedicated to intimate parts to optimize the current conductivity and to ensure that it respects the balance, the pH balance of the area. Okay? And you have to ensure that it promotes a good conductivity of the electrical stimuli and does not condensate it in small spots. There are some gels that are not adequate to high temperatures, okay? We have to establish a complete contact from the electrode to the zone that we are treating. And when the contact is done, after it starts the timer and it starts the emission. you hear a little beep. You have to calibrate the intensity according to the desired heat sensation. And when you're starting, it's better to start like in 10% or 20%. And after you know the answer of the patient to the current, you can increase it, okay, to desired diathermy. It's important to always give the safety handle to the patient, though, so that she can stop the session by herself when she feels it's necessary. For this type of patients, it's like a comfort to have the stop button all the time. And you have to be careful not to leave hair between the probe and the cover and the electrode, okay? You have to take all the air out and make sure that it doesn't have any bulb, okay? So with the reds and the bracelets, how can we work? You just work with your manual techniques and you get like a superpower in your hand. The bracelet must be placed on the forearm and a little bit higher at a height that will allow you the maximum liberty of movement and a fixed contact with your skin, okay? We have no problems to stretch a little bit the bracelet because it ensures the good contact with you.
Yeah.
You have to apply the gel on the glove and be sure to not leave any little air bubbles between the glove and your hand. You have to make sure you get a glove the right size of your hand, okay? Not bigger.
Dus deze niet.
So this one of the pictures not good, yeah.
I didn't understand, I'm sorry.
The one on the picture is not so good.
Yes,
Yes?
The glove on the picture is not so good.
No, the picture is not good. It's not a good example, okay? It's a big one. You don't have to choose that.
Yeah.
And the intensity must be adjusted according to your own perception. You feel it. You feel the thermical response. That's why you need to have also a good glove fitted to your hands, okay? The indicative time of using in this hands-free mode is 10 minutes for treatment, with hand washing with cold water after the end of the treatment if you feel your hand is hot, okay? If you want to return to calm and to lower the metabolism of the area of your own hand, you just wash it in the cold water after. And the contact with the patient should be direct without any light touch, okay? When you give a light touch, you're already closing the circuit. So you have to do a confident touch in the patient. So indication of this manual use is the scar mobilization, the precise manual work when you need to know what you're doing, like the first stretch to inducing the contraction, for the massage of the perineal area, or all the manual therapy that you use. The red bracelet allows your hand to replace the mobile electrode, so you will substitute the electrode from your hand. The Winback energy flows through your hand for greater freedom of movement. And this treatment is completely non-invasive, okay? What is our good things? It improves the healing by focusing the energy where it needs to be. The energy applied is inversely proportional to the contact surface. So that's what we told you before. If you have a smaller contact surface, you have a bigger response. And if you have a greater contact surface, it will spread the heating, okay? And you have a better feel to the evolution of the tissues and the control of the diathermia. When you have the double red, the two bracelets, the Winback 5.0 allows you to divide the red path in half. The red energy is distributed by the two red electrodes towards the fixed electrode. Thus, the manual technique with a bracelet have never been so intuitive, and with this you can do like a triangle of the areas that you're treating. In addition, the double red can be combined with the two flex electrodes, like I told you before, if you want to do a muscular chain work from the lower limbs. you can connect two active electrodes, one for each limb, and place the return plate on the back.
With 2 bracelets, how much you increase the intensity?
It's
2
the
times
same.
more?
It's the same. No
It's the
problem.
same. Okay.
The intensity will spread for the two. So you have to adjust it a little bit more, okay? Because they will feel less. But as I told you before, the answer for the patient changes each day. Why? Because it can be less hydrated. It can have a little bit more tension. So you just adjust it you put it like 20-30%, and then you increase it by the feeling from your hands or by the answer of the patient. Okay.
Okay.
We can also have the Winback hands-free, that both hands are free for manual action, and you can do in autonomic treatment. The patient can still do all the exercises, or you can adjust your stimuli or mobilization with the hands-free from the electrodes. So how do you put the hands-free mode? You set up on red the adhesive plate and the return adhesive plate, depending of the energy path that you want. You check if there's a good contact of all the electrodes with the patients. You put the timer, you increase the intensity gradually until the desired diathermia is reached. So you start step by step. Once the intensity is calibrated, you switch to the low pulse or the mini mode, so you can ensure that the diathermia is comfortable. The treatment, you set it for 10 to 15 minutes, and you always give the safe handle to the patient. In the Winback 4.0 indications, we use it in chronic and acute tendinopathies, in fasciitis, in carpal tunnel, in scar adhesions. In pelvic floor, you use it if you have a scar or fibrosis that we really have to enhance the new vascularization, new collagenesis. The dynamic mode allows us to alternating between 2 frequencies and thus stimulate tissues to the depth of 1 to 0 from 0 to 1 centimeter of deepness. The Winback mode 4.0 use, you apply a thin layer of conductive cream on the patients. We respect the low pulse, the mini, or the super pulse boost principles, and you just massage all the area with the electrode on your hand with circular motion movements. The treatment is shorter, the time of the treatment, so you do like 2 to 3 minutes of treatment in a specific area. So in summary, the instructions for use. So you have to follow the basic rules of hygiene standards concerning to electrodes before using and after. You only use a Winback conductive gel on mucous membranes or a Winback Tecar VP compatible cream on the other areas. You don't use any essential oils or moistures. You always use gloves. It's mandatory use of probe covers on set and red electrodes for perineal area. It's essential to maintain the regular contact between the electrodes. Always have a confident contact. Before each treatment, pass an intimate wipe to ensure work on clean area. Do not put plates return of fix over bony preeminence. It's better to choose a good area with full contact to a little bit more not so close, that to put the plate on bony preeminence, because we don't have a good contact, okay? areas require a little bit more cream to ensure a good contact, okay? We should remove all the jewelry that does not provide a fully contact with the skin. Avoid any contact with hair or clothing because it stops the current and gives us a little sweet twitch that it's not comfortable. Ask for constant feedback on the temperature from the patients, and always to be creative and have fun. That's a good. Oh, sorry, I've done something wrong. That's a good mode. Okay, so pelvic floor, we have different uses. The basic one with the electrodes, with the sensors. The pro one with manual mode, with the bracelets, or the hands-free mode with the fixed pad adhesives. Okay, we have a lot of studies that you can search for the use of the Winback therapy. And in Winback Academy, we have different stages of formation. You should go to winbackacademy.org and do your registration. Like that, you will have a fully open library of protocols or videos or demos, so you can have a guideline for you to work on. So now we'll see a little bit of protocols for the pelvic area. And here we have the reasoning steps. What do I want to achieve clinically? What is my objective? I want pain management. I want to reduce spasm. I want to stimulate healing. I wanted to regain movement. Which is my objective? It's important to know also what technique am I going to combine with. Am I going to do a massage? Am I going to do a mobilization? It's better to have the free mode so I can have my hands free. I want to do a fascial release. I choose the fascia tool so I can work with it and have the profiter with me back with the fascia tool. I want to do some exercises. I want to do some cupping. I use the free hands mode. Like that, I can combine it with my techniques. 3, what is the correct position for the patients to be in? I wanted to put it in prone, or I wanted to put it on supine. I want to be standing or sitting or moving. Am I going to stretch? Like that, we choose what technique and which electrodes we will use. In 4, which mode I should use? I want to work superficially. I want to work capacitive, or I want to go a little bit deeper. I work in deep set. I want to work in a chain. I want to work in deep tissues with high resistance. I will work in red or red plus. I want to work in a specific spot that I want to increase the energy, or I have a scar where I want to work really with high intensity and really quick. I work with the mix or the mix plus. Then in 5, we want which electrode and what placement am I going to put? Will I work with the mobile electrode, the adhesive plate, or the bracelets? The 6, we have which additional settings am I going to choose? The dynamic, the low pulse, the super pulse, the low beat, the super beat. We really need to know what each one of these modes do so we can achieve our objectives. And in 7th place, what intensity will be required? So in what stage we are? We are in the acute stage, we work in lower intensities, or we are in the chronic stage and work with high intensities. I want a thermical effect. I want an analgesic effect. I have to work in 30%, 40%. We want the heat effect. We want to reduce, overstimulate the nociceptors. We want to reduce the tension of the tissue. We work in high frequencies. Then we have to apply the cream and we are ready to go and do our protocols. So what about the reasoning steps? Each Winback treatment will be based on a physiotherapy diagnosis. So we have to do good evaluation that will determine the clinical sign, the contraindicated criteria for the use of Tecar, the objectives of the session, if it's the analgesia, the trophicity, the vascularization, the muscular tonicity, what were the causes of the pathology of the disturb, if you are in acute, subacute, or chronic nature of the pathology, which therapeutic approach we are going to choose. If the patient has a lot of pain, we can work in distant approach and not having a manual effect that will increase the contracting of the patient. If you want to work locally, we can go directly. We choose the approach by our evaluation. It will then follow the installation of the patient, the Winback accessories, choosing the parameters of the current as well as the manual techniques for each phase of our protocol. Note that these protocols are presented as an indication with the clinical signs most frequently seen for the type of pathology. But it's really essential to, not again. But really is essential to adapt them to the problems of our patient and do his or her evaluation before performing any technique, okay? One thing that is really important is the return calm phase. We always do it in the end of each session. And what is the return to calm phase? Is the regulation of the metabolism to avoid a possibly rebound effect in the end of the first session or in acute inflammation pathologies or in neurovegetative sensitivity, okay? So how do we do the return to calm phase? We choose set soft mini or red soft mini. We work in 10% of or 20% of intensity, and we do soft and draining manipulations at the end of each treatment. Okay, we can choose from set or red, but always in 10%. Okay, in a physiological scar or inflammatory and vascular phase of the scar, the objective is to increase the vasodilatation and cutaneous permeability. We want to improve the biological effects, but we don't want to induce the inflammation and the response. The cautions that we have to do, we have to evaluate the scar infectiousness. We have to ensure that we don't have any infection, okay? We can have inflammatory signs, but not infection. Okay, how do we work with set soft or the mix heads? And we work at the methods that we work, we stay around the scar or around the bandage, okay? We don't say on the scar. Like I told you before, if we have an open wound or a stretched scar, we work around to ensure the good management and the good regeneration, the creation of good tissue, good collagen fibers, good fibroblast action, but we don't work on the open wound, okay?
Do you recommend the pulse 2 or 4 hertz in this phase, the fresh scar?
I didn't understand, I'm sorry.
Do you recommend a beat 2 or 4 hertz?
No.
Why?
In this space, I usually work with the set or the mixed space because the little twitch is not comfortable for the patients, and the little twitches, if you have the scar in the middle, you don't have to open the scar, right? You want to enhance the closing. If you have new tissue bounding, you want it to close, not to open. And
yes, but
with the twitches you can open it.
I understand, but with bracelets, you don't have that strong effect, and the drainage is better. So you don't recommend it even in that way?
I prefer to use the other one.
Okay.
Okay. In my practical, I prefer it. Okay. When you have in a physiological scar, when you are in the tissue repairing phase, what are our objectives? It's to optimize the action of the fibroblasts and the neovascularization. Our main concern is to evaluate once more the infectiousness of the scar. Here we already work on orange, 30–40%, set soft or mix, and you just stay around the scar or around the bandage, okay? Here you work on set or mix phase to stimulate the area. When you're in maturation or a modeling phase, what are our main objectives? Here we don't, our objective is to support the anabolic and the catabolic phenomena. We wanted to optimize the rearrangements of the extracellular matrix. We want to rearrange the orientation of the collagen and the elastin. And we want to do the mobilization and the gliding of the connective tissues. Here we can use the 4 Hz stimulations, okay? Here it benefits us. So we start with the soft, like 30%, and we massage around the scar and on the scar, okay? In this phase, it's already closed. We don't have any infection issues. Then we work with the mix, with fast run movements on the scar to gain the alignment and to break the little fibrosis under it. And you end with the red, the deep in 10% with the manual manipulation of mobilization of the scar, the gliding of the connective tissues. In first, you work on orange and on red to alternate the trophicity and the tonicity of the tissues. You increase the heating of the fascia to get it more mobile and to get it able to be aligned as you want in the last phase, in the manual manipulation and mobilization phase. Okay?
What about overgrowing scars that they have tendency to be, you know?
You shouldn't use it, okay? Because overtensional scars, well, we have 2 kinds, overtensional scars or keloid, how do you call it?
Yeah, it's understandable.
On keloid, we don't work it, okay?
But not on the scar or definitely with Winback?
We don't work it at all because on keloid, we have an answer of not normal growing of tissue. But if you have a hyper scar, how do you say it?
Hyperthermia, you mean? Or
No. The name.
Hypertrophy of the tissue, you mean?
Okay, you can work on it. What do you want? If you have a hypertrophy of the scar, you want to stop the fibroblast action, okay? You want to tell it, it's enough. We don't want more tissue. So what do? You do the pressure until it stays white, okay? You stop the port of oxygen so we can stop the work of the fibroblasts, okay? Put tension, you see until it's white, you count like 10 seconds, and then you stop. You have the anabolic effects. You stop.
Okay.
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 You only don't work on keloid. Okay. Keloid, no way. You will just increase it. Okay.
Okay.
Ja, omheen, toch? Ja, eromheen. No.
Hans, do you have any doubt?
Oh,
No.
not me. No doubts at all.
I didn't understand. I'm sorry.
No, it's okay. I'm no doubts at all.
Okay, so pathological scars. The indications, we have the fibrosis, the troubles of the catabolic phenomena, like I told you before, during the maturation phase with the remaining scar tissue instead of healthy tissue, okay? We can work on it. In scar adhesions, troubles of during the phase of the debridement with remaining fibers of fibroconnection between the gliding connective tissue. On the retractable scars, when you have remaining myofibroblasts after maturation phase, okay? And in hypertrophic scars, when you have the disturbance of the vascular phase and the of the fibrins network with a remaining proliferation of the scar tissues in the scar core. The only contraindications is the keloids,
Okay.
because it's an exacerbated response of the conjunctive tissue with a proliferation of the scar tissue outside the scar core, okay? Here we cannot balance, here we cannot not work on.
Thank you, Inês.
Like when we have a retractable or hypertrophic scar, what is our objective? Is the biological stimulation. So how will we have to be cautioned that all the techniques aiming at the stimulation of the local circulation will increase the pathology. So we want long-lasting stretching techniques during a few minutes to cause the hypoxia that will lead to a disappearance of the myofibroblasts. That was what we were talking before, okay? Adhesions and fibrosis. The objective is to mobilize the superficial planes in relation to the deep planes, okay? You work in set or mixed soft in thermal, okay, response 40%, 50% to ensure the revascularization and mobilization of the cutaneous planes. And then you work on rep and deep ret with the manipulations leading to rolling and massaging and molding phase. We can also use the hand-free mode or use the tool, the fascia tool that we told before. In the immediate postpartum, we can work in clinical signs, inflammatory scars, oedema, puerperal hematoma, or perineal pain. Our main objectives will be the analgesia, the drainage of the area, and the improving of the metabolism of the area. Our approach, honestly, is remote. Why? Because of the sensibility of the patient and the open wounds that are there. How do we work? We can work with the Red Soft Mini, with the hands-free mode, with the adhesive electrode paste in the inner size, okay? And we work with the drainage and massage techniques with our hands-free. And we can also do a local approach with the set dynamic, only in 10%, okay? Low intensity, scanning all the perineal area, but not doing many stimulation with the electrode, okay? We use the convex with 35 millimeters because of the feeling, the analgesic feeling of the mechanical, of the mechanical of the electrode. In cesarean scar, the first step is our objective is to improve the cutaneous scarring and the gliding between the connective tissues because of the suture. We work on set soft. We work all around the scar and then directly on the scar using the electrode to mechanize the tissues and to do the mobilization by insisting on the areas of adhesion, always to the middle, okay, not getting apart the parts of the scar. On the second step, with the dynamic mode, we work on the scar and all the pubious area to the anterior inferior iliac spines, okay? We do all the movements and walk all around the area. On the third step, we work with manipulation around the scar, the deep manipulation of adhesions. We work in the muscular insertions of the oblique muscles and rectus abdominal muscles that are not well positioned, okay? We wanted to reposition it and to stabilize it and stimulated to have a good contraction. And we can do the manipulations of the ligaments in the sacro-uterine abordation, okay? We work on reds deep, usually with the bracelets. On, if you wanted to do with your hand the manipulation of the ligaments, or you can put in the thighs the hands-free mode and do the simulation with your hands, okay? On the first step, we work with the red deep bracelet, and we do the manipulation of the scar, we do the crumble, the loose indentation, we mobilize the deep planes, and we get the benefits from working with the thermia before. In the diastasis, our main objective is to improve the quality and the realignment of the collagen fibers in the alba linea. And we also want to support the muscular recruitment to be effective and reposition all these muscles that they are completely out of their range. So we start with set stop, with a little manipulation around the alba line, okay? We work with the convex, so we can have the mechanical effect of the electrode. And then we work with the red soft mini, with the hands-free or the adhesive electrodes to support the muscular recruitment on the abdominal, to stimulate the internal and external obliques, to recover the tension of linea alba thanks to a work of co-contraction of the rectus abdominal muscles and the large muscles of the abdomen, okay? With your touch, you can just stimulate the notion of the patients where to contract and how to contract. We can also work on the diaphragm, that the postpartum is completely out of its range. The indications are the preparatory work for the rehabilitation when you have the recent postpartum, when you have a hypertonic perineum and the diaphragm is not working as it should be, when you have a postural disorder, or if you are working on constipation or even in pelvic pain. The objectives of the protocol on diaphragm sessions is the tensions relief, the restore of the correct chest expansion, and free up the movement of all the diaphragm. You start with the set dynamic, working on the solar plexus, okay, and the subcostal zones, just to hit all and stimulate all the areas to be available to our work. And the red soft, you do the massage, the mobilization of the lower ribs. You can do a respiratory work and repositioning and teaching how to do the good respiratory work. And we usually put the return plane in the thoracolumbar area, okay? So we can have all the activation of this area. Then we end in the red softy mini in respiratory and functional work. We usually, the free hands mode or the adhesive electrodes are, in my opinion, the best way of action, okay? We put on the plexus, solar plexus and on the thoracolumbar the return plate, and then we have our hands free to do like the work, the respiratory whorl and the vascular on the Swiss ball. In perineal rehabilitation, I'm sorry, but the time, it's okay. We just have to see more.
We're almost there.
We are almost. So the general approach for perineal rehabilitation, when you have a hypotonia, perineal hypotonia, our objective will be the improvement of vascularization and trophicity of the perineum, okay? We wanted to optimize the tensor effect of the anterior and rear perineum support of the awareness of the perineum. So what we will work with the set soft, work on the fibrous core of the perineum, on the perineal muscles, the anterior and the rear one, okay, with the convex, and you benefit from the mechanical head, the convex head, so we can work on all the perineal area and to activate it. Then we go to the bracelets to work in deep breath to provide the stimuli to the muscle to contract. So we will work on the awareness of the patient of his own contraction and the awareness of the zone. Okay. If you have,
maybe we can wrap up a little bit, I think we have some questions more. The rest we can read over. It's okay.
okay. So about the questions, this is just the approaches. If you have to work on the urethra, you can place your plate zone, your return plate on your sacrum, okay, and you work directly on the area you are planning on. When you're working on superficial dyspareunia, you work directly on the area with the massage around the vulvary, with the action of the superficial perineum. You can use also the bracelets to release the ischiopubic branch externally, or to work in the contraction and release of the perineal muscle. If you have a deep dyspareunia when you have endometriosis, or adenomasis pain when you have a congestic syndrome of the pelvic floor, you can work on the pelvic area and the perineal area. Just make sure to put the return plate in the right position and the active electrodes, okay? We have also a vaginism protocol, pudendal neurology protocol. In cases of anorexia rehabilitation, we always work on, okay, on men, both men or women. When you have a myofascial syndrome, okay, you want atalgia, you want the remodeling the fascia, you want to improvement the climbing of the plates. And this was the protocol's presentation. Okay. Questions?
Thank you.
I'm so sorry, but the time just ran out.
Okay.
Questions?
Questions?
Nee, it was a lot of information for us. But when I started the academy, then they will tell me about this, the practical thing.
So we will discuss this later on, but let me first, so let's start, let's say you will start with treatment and so on, and you have quite a bit of questions still, you know, because this is nice what we received, but we still, you still need to work with it.
Yes,
you know,
yes.
the practical part, that's the most important. Is there a possibility that they can contact you about this and so on, Inês? Hello?
I'm sorry, but I didn't. You're having little cuts in the connection.
Okay.
Hans, can you hear me?
Yeah,
Yes.
I can hear you very well. Can you hear me also?
Yes, now it's okay. You want to know about the practical with hands-on. That's it?
Yes.
Yes, we can do it. No problem. Today, Maud Sophie told me that it was a short presentation, right? Just to present. How can you hear me? I think I lost you.
No, you can. Do you hear me?
Yes, I hear you. Yes.
Okay, listen. Correct. Today is a short presentation. We need more. I think it makes sense that you first start with it in a small part. Then they will have questions. You know, of course, there will come questions. So, is there a possibility that they contact you for some questions and then schedule the next step?
No problem at all. If you have any doubt, any question, any clinical case that you want to share with me, it will be a pleasure to talk with you, because it's really difficult. It's a lot of information to give in just 2 hours. And if you are in person, sometimes the words go away from me. I'm sorry. But in person, I can show you and I can tell you how to work, how do I do it. So this was just some ideas. And if you can think about it, and then we go to the next step. If you
Right.
have any doubts, if you have clinical cases that you want to work on, I'll be available for everything that you want.